All right, we're going to get started. Welcome again, everyone, to the 2022 Planetary Health Annual Meeting at Harvard University. I would now like to introduce Dr. Louise Ivers, who will moderate the session on perspectives on the field of planetary health. Dr. Ivers is director of the Harvard Global Health Institute, director of the Massachusetts General Hospital Center for Global Health, and the David Bangsberg Endowed Chair in Global Health Equity at Mass General Hospital. You can learn more about our moderators and speakers on the annual meeting website. And welcome, Dr. Ivers.
Thank you. Hi, everyone. It's great to be here, and I'm looking forward to this conversation. I want to take a minute to introduce our two panelists, one here with us in person, and I hope one that we'll see on the screen momentarily. Here with us in person is Dr. Nicole Redvers. She's a member of the Dhaliwal First Nation. She's a co-founder and chair of the Arctic Indigenous Wellness Foundation and an associate professor at the Schulich School of Medicine and Dentistry in Western University in Ontario. Dr. Redvers sits on the inaugural advisory board for the American Public Health Association's Center for Climate, Health and Equity Steering Committee. She's a senior fellow of Indigenous and Community Health with In Vivo Planetary Health and is on the steering committee of the Planetary Health Alliance and on the external advisory board for EcoHealth International. So welcome. Thanks for being here.
See.
And Dr. Mandeep Dhaliwal, on the line, is a physician and lawyer. She is the director of the United Nations Development Program's HIV and Health Group. She brings to the organization of UNDP over 20 years of experience working on HIV, health, human rights, and evidence-based policy and programming in low and middle-income countries. Dr. Dhaliwal joined UNDP in 2008 as a cluster leader for human rights, gender, and sexual diversities. And she has been a true champion of planetary health for more than a decade, really shaping UNDP's portfolio around planetary health. So welcome. I can see you now, as we all can. So it's very nice to be with you in this virtual space. So we want to have a conversation today about both of your experiences and reflections on planetary health. And I'd like to start with each of you with the same question, which is, how do you see the planetary health framework as bringing value to the work you do and with the communities you work? Maybe we'll start with you, Nicole, here.
Yeah, absolutely. Thanks, Masi Cho, for the question. And happy to be here, and nice to see you, Mandeep, online there with us today. Last week, I was sitting with a Cree elder in Treaty 6 territory, in, otherwise known as Alberta in Canada. And she shared with me a teaching that one of her elders had shared with her. And she said, Nicole, the truth comes in the words that we speak, essentially. The truth comes in the words, or the truth comes from the words. And, you know, I thought about that for a bit as I was coming here today, because on the BBC there was a news article that, radio station commentary that was saying, well, Indigenous knowledges are philosophical, and it's hard to think about integrating traditional knowledges with Western science, and what does that mean in application? And I thought back to Leona Makokas, this Cree elder's words, the truth is in the words themselves, the truth comes from the words themselves. And I realized that, yes, there was a philosophical component to that, to what is truth and how we live about our lives. But what I realized is that there was a very applied teaching within that. Because one of the components and the most minimized aspect of climate resilience, biodiversity, protection, as well as teachings against harm to our planet come through Indigenous languages. And Indigenous languages are verb-based. They're process-based inherently in the way that they're structured. They are not based on nouns. So each and every word carries a teaching of life. There is a narrative, there is a story that comes behind that. The truth comes within the word, because the truth is based on the reality that comes from the land ourselves. So in that, we have, as Dene peoples who I come from, De means flow, Ne means land. We flow from the land as peoples. We are the land. That is inherent within the word. The truth is in the word themselves. So when we think about that, if we come from the land ourselves, we are in and of itself nature. We are interconnected within nature, as per the planetary health framework describes that central component of it. But in essence, at the same time, coming from nature requires then a sense of responsibility, language, of course, but then also how we treat and live within the planet in our day-to-day lives. So it was fundamental because there were so many layers to that one simple phrase that, yes, it was philosophical, but it was also very applied. There's not very many frameworks now where we can think about the social sciences, environmental sciences, health, because we do know in our communities that those that speak greater amounts of Indigenous languages have lower rates of youth suicide, for example. There's health protective factors in that. Yet, the transdisciplinary nature of our discussions just doesn't fit within other disciplines. We talk with linguists about language, but when does that cross over into health spaces and the protection of our youth against suicide? When does it creep over into the environmental space? Because the Indigenous language is a blueprint of the land. The taxonomies, the relationships, the narratives, the teachings within those stories are directly within those words themselves, being a conglomerate of how we think through solutions-based pathways forward. And there's not a lot of other spaces that you can do that, but you can do that through a planetary health framework in the way that I see it through my Indigenous lens, because it can be encapsulating. And that's why I personally like to work within that narrative, because it fits within a flexible space where an elder has 6 PhDs in many different areas of applied knowledges, and how we think about all of those systems interacting just doesn't fit within the standard frameworks that exist in many other academic disciplines. So that's kind of how I reflect through that.
Fantastic, thanks. And Mandeep, can I turn to you with the same question?
Thank you. Thanks, Louise, and lovely to see you, Nicole. It's really an honor to be here. I guess I would come at this question at 2 levels. One, around the planetary health framework being really integral to how we approach our work on health, climate, gender, environment at UNDP. So our focus is very much on the determinants of health, the social, the economic, the environmental, and really work outside the health sector that really shapes and influences health outcomes. At the same time, we look at how do we help countries deliver on their climate commitments? How do we protect biodiversity? So for me, the planetary health framework is a really important multidisciplinary framework that helps us bring that together in a very coherent way. So it moves away from this siloed approach. It helps us look for the multidisciplinary, integrated solutions that can help us improve and protect the health of people and the health of the planet at the same time. So it's a really powerful framework. It's something that has really resonated with me at UNDP. We have a large health portfolio. We have a large portfolio of climate and environment projects as well. The planetary health framework helps us connect this in a really powerful way. So I've spent a lot of time using the framework to help connect the dots within the organization, getting climate colleagues and colleagues working on environment to also talk to colleagues who are working on health and really connect the dots in a powerful way. So I think it's very, for me, it's been a very practical tool, but also I think, it's a framework that was in some ways before its time when I first started to get to know it. And I think now when you just turn on the news any day and you see the emergency nature of the climate crisis, and you see very clearly, for me anyway, it's very apparent that what we need is a planetary health approach, whether it's to deal with emerging outbreaks or pandemics, the climate crisis, loss of biodiversity. It's all connected. And the framework helps us identify these connections in a very sensible way, and in a practical way to figure out where we need to invest time and energy. And I think it's really, really important in bringing these communities together. So I think that's my other point, that It offers a framework to bring the climate, environment, and health communities together. And we saw, at COP26 now, all of a sudden, there's a growing understanding and urgency in the health sector for their commitments to addressing the climate crisis. So it's, I think, a very, very useful framework. We've used it a lot at UNDP. We have championed the work of the Planetary Health Alliance by being a collaborator on the Sao Paulo Declaration. We continue to use that in our advocacy and policy work with governments, with civil society, with communities. So that's how I'm using the Planetary Health Framework within UNDP.
That's great. I mean, I'm coming from the health sector, although within my framework, I work across a number of aspects of health, but I find sometimes we have a scarcity mentality within our own group. So we're often tugging for resources between ourselves instead of stepping back and thinking about a bigger context. And so for me, when I think about planetary health, I see it as such a wonderful framework. And I'm curious, Mandeep and also Nicole, if you see pushback on using this framework, if within your work and your communities that's related to thinking about scarcity, why do you think, what are the reasons why people are pushing back on this, or are they? Or is everyone getting on board with this approach?
Okay, shall I start this time?
Yeah, why not?
Okay, all right. I mean, I think there's growing understanding of the approach. I think first there was a bit of a, people may not have understood it as well before. I certainly feel, especially through, I think, some of the excellent work that's been done around the Sao Paulo Declaration, I feel like there's a growing understanding and constituency that sees the value and the importance of the framework. So I think part of it was perhaps just an understanding issue. I also think, the climate crisis has, and then the related crises in terms of health. I mean, just look at how many cholera outbreaks we have all of a sudden that we're dealing with. Look at the disease outbreaks that we're dealing with. So I think people are understanding, it's sharpening their focus a little bit that, this approach and framework is actually something that will help us come up with the kinds of solutions that we need to deal with this, an environment which is basically, you could call a poly-crisis environment. Sadly, it took a crisis, it's taking these kinds of crises that are quite complex in their interconnections for people to understand the value of this framework. So, and start using it very practically. So for me, I think that's the trajectory that I see. There's always a little bit of, I think, I worry a little bit about people not understanding the breadth and depth of the framework and its flexibility and its power. I worry about people reducing it to One Health, which there's a tendency of, and then One Health thinking that planetary health is the same thing as One Health, which it's not. So I think that is something we need to continue to clarify and continue to deal with. But I do feel like there's much more space. I mean, I'll just, next year the G7 is being hosted by and being chaired by the government of Japan. They're already thinking about, what they're going to advance. And, I was very happy to see that their planetary health is already there in the discussion. It's something certainly from UNDP's side that we will also be advancing as an important issue that provides a framework for them to connect the multiple issues that they want to look at in the context of health and human security. So I think there's opportunities there for us to really take the framework forward. There's always going to be, I think because there's a scarcity of resources, unfortunately, people like to stick to their silos and just kind of wave their flags, for lack of a better way of saying it. But I think we need to kind of push on, and I see a growing understanding of the importance and of investment and action in this area through this framework.
Great.
So,
thank you.
yeah.
Nicole, you spoke earlier about the framework really fitting with what I will say sounded to me very much about the Indigenous way of knowing and what you were quoting from the elder. How do you see the progress in the communities you're working with as you try to bring and center that Indigenous knowledge and way of knowing in and bring Indigenous communities or your own community into the work of Planetary Health? Are you finding acceptance of that? Is there more work to do?
Well, I would say I'm trying to get the Planetary Health into my community, which is, very different because the lens of the way that we view the questions, the problems we derive automatically inform the solutions. And oftentimes we are sort of being, pulled in the other direction, but we've been very firm in our communities to say that this way of thinking about the world and relating to the world, come and listen, we have 2 ears and 1 mouth for a reason. It was a teaching, from another elder that I was given very young, because that's, ultimately what it comes from. And I think one of the, I just want to broach on this piece, because there's so many terminologies out there now, planetary health, One Health, Mandeep, you mentioned, eco-health. Yeah. And I'm reminded of by the Lakota physician, Dr. Donald Warren, who, as we debate about, in the U.S., are we American Indian, are we Indigenous, are we Native American, are we this? We're arguing about what English word to use, when in fact it's who we are, our Dene, our Lakota, our Nakota, our Ojibwe, these peoples. But the inherent form of that is all of those names come from the land and aspect. So if we are informed by our foundational premise, it doesn't matter what you are. If you're coming to the same value system, recognizing that this beautiful earth that we breathe, that we feel, that we stand on, that we eat, that we consume, that we touch on a daily basis is who we are as people. And we lose that in the complexity of all of these spaces and things. And when it comes to things like resources, there's no better people to know how to deal with low resources than Indigenous communities around the globe. Yet they've come up with amazing solutions by being innovative, by being creative, but by not getting mired with all of the details that come around, because there is only so much to deal with. There is only so much to work with. And you have to think that way, think in a sense of scarcity, so to speak, because of how much things have been pulled from communities, taken from communities. But it's why there's so much beauty in that and so much simplicity in it sometimes that we get lost in this complexity. The truth is within the words themselves.
I'd love to get both of your opinions on where you see the leverage points for the great transition, for the great turning, for how we as humanity can reset our way of living. In pragmatic terms, maybe Mandeep, I'll turn to you to start on this one. In very pragmatic way, you have been shaping the way UNDP approaches this through the work that you've described. What do you see as the opportunities in the next coming months, years, to really leverage that for big change?
Thanks so much. And it's something we've talked about a little bit in the steering committee of the PHA. And I imagine it's also for discussion in the advisory board, but there's some big opportunities at the UN. And one is, is positioning the Planetary Health Framework as an important vehicle for delivering on the Sustainable Development Goals and the pledge to leave no one behind. And the Planetary Health Framework, I think, is unique in the sense that it offers those kinds of integrated solutions and connections across the various goals and targets, and helps us to also focus on those who've been left furthest behind in a very powerful way. So I think as a starting point, that's really important to continue to advance that. At the same time, in the last 2 years, we've been dealing with, a spate of crises, food, energy, economic, multiple pandemics, conflict, war. And we see that, the impact of that is making the task of delivering on the SDGs and their promise even more complicated, and as a matter of fact is pushing us off track. We're losing ground. The Secretary General is really thinking about the future. How do we get back on track? And he's proposed a summit of the future for 2024. He's got this agenda, our common agenda. What are the things that we need to do to get back on track? As part of that, in 2023, he'll be having a series of dialogues and consultations with countries, with governments. I think those consultations also need to include communities and civil society. And I think that's where we have a real opportunity to position and advance and amplify the messages around the framework and talk about the framework and really embed it squarely in those high-level discussions. In 2023, there's also 3 or 4 big opportunities at the UN around health, more broadly: universal health coverage, pandemic preparedness and response, and tuberculosis. All 3 of these there will be big high-level meetings. And they're, again, an opportunity to use the planetary health framework to really show its contribution in advancing human health, and at the same time, the health of the planet. I think we have to move away from this unfortunate kind of discussion around trade-offs, because I think it's with trade-offs that we've gotten into the mess that we're in. So we need to really talk about the great transformation, changing the way that we live as an essential transition, as a tipping point, rather than talking about trade-offs, which, buy into this kind of capitalist, colonial sort of approach of extracting, resources from one, or extracting from one field at the cost of another. So I think the Planetary Health Framework offers us an opportunity to change our way of thinking towards the great transition. And there's certainly a lot of opportunity in the multilateral space over 2023 and 2024 to really embed that understanding and the use of the framework at the highest levels of government and in countries. Yeah.
Great, thanks. Thank you. Nicole, same question to you in terms of where do you see leverage points, big opportunities that we should be seizing?
Yeah, well, I think there's a obvious huge appetite in the last few years on traditional ecological knowledges and traditional indigenous knowledges globally. It's exploded in the last few years, I think partly fueled by the pandemic and this inner reflection that many societies and communities were going through in this time, sometimes of loneliness, where we had to sit with ourselves. Really, we had to sit with ourselves, and we had to sit with our families and our communities, within spaces, and that often creates a tipping point within ourselves to reach for things. And I think Indigenous knowledges are part of that. The issue that I've found, however, in that is that there's often a gravitation towards Indigenous knowledge, but note in that there's no mention of Indigenous peoples. It's Indigenous peoples that hold that knowledge, and Indigenous peoples, are going to be the ones that carry and hold and steward that knowledge. So, yes, there's huge opportunities within that space, but it really is foundation on relationships of trust, on free informed consent, on the rights of Indigenous peoples. There's so many capacities and complexities that come around that. But I'm seeing more and more communities who were usually very hesitant to share due to very real exploitation, both historical and contemporarily, and ongoing rights abuses around the world, who for obvious reasons don't want to engage with colonial institutions and practices that have perpetuated those disconnects between ourselves and planet. But I have seen communities recognizing the dire straits of the earth. And I was just listening to a conversation just yesterday on a community that had really kept themselves isolated for very good reasons, who have decided to come down from their mountain and engage with community because they're seeing the direct changes in their environments, and they're worried and they're concerned, and they're wanting to now come and share with the world. In fact, that Cree elder that I was just talking about, she also told me, she said, Nicole, there's a prophecy in our community that there was going to be a time when people would start to come to us. They would start to come to us. And, you know, I think about that a lot in terms of this time now that we're in right now. And, you know, the opportunities that we have in shared spaces to be able to listen and to learn and to be, and I think there's value and opportunity in that if it's done in a good way, if it's done in a good way.
Yeah, thank you. Thank you. We have 5 minutes left, I'm seeing from the timekeeper. Mandeep, I think of the United Nations as a big bureaucratic institution that does a lot of good and also can be, I'm thinking, maybe projecting, can be a hard place to be innovative, maybe not. How did you, maybe you can tell me if I'm wrong on that, but how did you manage, or how did you tactically help to advance this framework within your midst? Or maybe I'm totally wrong and everybody was all on board with the planetary health framework from the beginning. But how did you build alliances or, you know, get the work done? You mentioned connection. You both have used the word connection in describing this framework. I'd love if we could get some very pragmatic information from you, Mandeep, on how you've been doing that. Oh, we can't hear you.
I was going to say, I have to say, I don't necessarily disagree with your assessment, but I have found certainly at UNDP, you know, a great culture and space for innovation and to think differently about things and to connect things from, you know, a policy discussion or a theoretical discussion to practical approaches on the ground. And I think one of the ways that I started with this is, you know, I was learning more and more about planetary health. I obviously was getting more familiar about with the organization's climate and environment work. And I lead the health portfolio, so, you know, and I was looking for ways to connect it because environmental determinants of health are one of the major influencers of human health. And I was like, how can we connect this? So I started out connecting with colleagues who I thought would share my interest and who this would resonate with. So that was our nature, climate, energy colleagues, our gender colleagues, because women are often at the sharp end of the spear in communities dealing with the issues that the planetary health framework can help us deal with. So young people. What was interesting for me in my journey of understanding the power of the framework and using it was listening to young people. And, you know, their approach is, and the way that they think about it is so transversal. You know, they don't think in silos. And so that for me was quite inspiring. And then I think one of the things that was useful for us is to look at our country level work. What's happening? UNDP is essentially a field organization. We have 140 country offices. Was to try and build allies in countries where they may have been using the planetary health approach and framework, but not identifying it as such. And really building allies and alliances in that way across our network of country offices. But, you know, just coming back to this point about the culture of innovation, we have, you know, I've always found, I also came from outside the UN to UNDP. You know, I found the space in the human development mandate to innovate. And this, over time, the culture of the organization and its commitment to innovation has really grown. And I see, you know, tremendous opportunities to continue to innovate, because that's the only way we're going to have a radical transformation in the way that we live. And the way that we do things is through innovation. We can't keep doing the same things we've been doing all along. You know, and we need to think about innovation. And for me, planetary health, the framework gives us space and actually impetus to innovate so that we get to this great transformation faster. I'll stop there for now.
Yeah, thanks. Nicole, reflections on that? In some ways, the idea that we're actually innovating, but we're actually just now, a few hundred of years later, maybe listening to what Indigenous communities have been saying from the time when they were colonized. What's your reflection on what Mandeep has been saying?
The institutional complexities are definitely there, but I think back to a teaching from one of my elders, Bessa Blondin. She's a Satu Dene elder, and when she speaks to people and she stands on a stage, it doesn't matter if it's to a bunch of government politicians or to health professionals or to students or to various groups. And one of the things that always amazes me when she speaks is she'll come off and she'll talk to me and she'll say, "The room switched." That's what she'll say. She uses her hands like that. She says, "The room switched." And then she just smiles. And Mandeep broached that. It's relationships. It's about developing relationships and connections and being mindful, because when we have a problem in our community, our elders sit back and they start to think about all the pieces together. They don't think about one piece in isolation. They talk about this, and then they start to put everything together in that way and figure out where are those relationships, where are the pieces that we need to fix those challenges or the buckles that are happening. Where do we need to go? They take this very systems approach, but they also recognize complexity and that it only takes a small tipping point sometimes to be able to make change. So they try to identify where that key piece is within the community so that it has ripple effects all over. So I think that really speaks to what Mandeep was talking about, is despite these complexities, if you really sit back and strategically think through and use those approaches of dynamic thinking, that you can have trigger points. If I can get into somebody, one person even, that's the effect. If they tell 10 people and they tell 10 people, but when you're an organization like the UN, that makes a difference. So having those people and relationships built, I think it's worth the effort. And for people like Mandeep in there, in the dredges, so to speak, we really appreciate, because I don't think I'd survive a day. But at the same time, we need people from multiple perspectives coming in. All the sides of the cup need to be looked at, because we don't only see, we only see one side ourselves. We need other people to be able to see the other sides of the cup for us.
Great. We are out of time for this panel, but I did want to take just kind of 15 seconds for each. Is there anything that you had wanted to say here that we didn't touch on? I want to make sure if there's anything left unsaid that you had a chance.
I think the one thing that I want to note is this is not easy work for everybody. And, it's exhausting work. It's tiring work for a lot of people that are trying to make great change and facing resistance sometimes at so many different levels. And one of the most important thing, I think, from that framework is that interconnection with the nature component. Because if we're not grounded as people, if we're not grounded in the work that we do, my elders will say you just start spinning. You're not rooted, you're not foundationed in an area. Just take care of yourself in this work, and don't forget to make that space to care for you, for your family, because otherwise it's going to get very difficult once you start spinning around that way. So I just wanted to mention that, because I think sometimes we don't think about ourselves enough, because we're obviously here for a reason, because we care about humanity, we care about society, we care about the earth, but we're going to have a very difficult time doing that if we're not grounded and rooted in who we are and where we come from.
Great, thank you. And thanks. I wasn't sure, Mandeep, if you wanted to say anything before we close out. I know we're out of time, but I didn't want to leave you there without a very last word.
Thank you very much. And I just wanted to, I fully sort of echo and support what Nicole has just said. I think one of the things that I have found about the Planetary Health Framework and being part of this community through the PHA is that it gives me energy, to really have the diversity of colleagues and perspectives who are coming at this through what I think is really the framework for the future. And I see so many things happening now, and that's just my perspective. There must be so much more around the well-being economy. around, the needing to listen to Indigenous communities and Indigenous wisdom, the engagement of young people that I think is really, really incredibly energizing. And I feel, and it's not just because I'm an optimistic person that I in the face of these great challenges, I do feel like there's a moment in time now where we can use this framework to really make progress on previously what were not issues that were not very well understood in terms of how we can connect across different communities and different disciplines.
Thank you. I think that's a wonderful note to end on. Thank you both very much. It's been my privilege to have this conversation. Thank you.